and welcome everybody for today's topic of discussion. Today's topic of discussion is a newer and interesting one, that is diabetes and immunization. One question comes into mind, whether a diabetic patient should be vaccinated or not. The answer is definitely yes. If you are diabetic, you should be vaccinated and remain up to date as per immunization schedule, because due to high blood sugar, the mechanism that maintains the body immunity gets compromised. So, irrespective of type of diabetes, that is type 1 or type 2, irrespective of age, irrespective of sex, a diabetic patient, due to its compromised immunity because of its high blood sugar, become more vulnerable for vaccine preventable diseases. That is why if you are diabetic, talk to your doctor today and remain up to date regarding vaccination, because prevention is better than cure. Then coming to the point, what are the vaccines available for a diabetic patient? Actually, there are 5 vaccines that have justified reason to be administered in diabetic patients. Number 1 is influenza, number 2 is pneumococcal, number 3 is hepatitis B, number 4 is Tdap, and number 5 is zoster. Then coming to individual discussion, that is discussion regarding individual vaccines available for diabetic patients. Coming to first one, that is influenza. Everybody knows influenza is a flu vaccine, and when it becomes complicated, it causes sinus, it causes ear infection, it causes bronchitis, and also pneumonia like complications that causes hospitalization and at times it leads to death of the patient also. That is why CDC, the Center for Disease Control and Prevention, CDC guidelines recommends every diabetic patient should be vaccinated annually once for influenza vaccine, and that should be in the early days of September. In the early days of September, a diabetic patient should be vaccinated with influenza vaccine. And remember one thing, as soon as you take the vaccine, you are not capable of preventing the influenza infection also. It takes about 2 weeks. It takes about 2 weeks to be effective inside the body after administration. And one notable point, if a patient having the history of allergy to egg, remember, having the history of allergic to egg, he or she should avoid influenza vaccine. History of allergy to egg, avoid influenza vaccine. Remember this. Then coming to second one, that is pneumococcal vaccine. Patients with diabetes are more prone to develop pneumonia, that is infection of lungs, bacteremia, that is infection of blood, and meningitis, that is infection of tissue around brain and spinal cord when gets pneumococcal infection. When pneumococcal infection is coming to the patients of diabetes, they are having more chance to develop pneumonia, bacteremia, and meningitis. Remember this. And also remember one more thing, patients having flu are having more chances to get pneumococcal diseases. That is why CDC recommends single dose of pneumococcal polysaccharide vaccine 23 to a diabetic patient below age 65, and another dose after age 65, and also single dose of pneumococcal conjugated vaccine 13 with a gap of 1 year from the dose of polysaccharide vaccine. And remember, the gap between 2 doses of polysaccharide vaccine, that is pneumococcal polysaccharide vaccine 23, is 5 years. Gap between 2 doses of polysaccharide vaccine is 5 years, and gap between polysaccharide vaccine to conjugated vaccine is 1 year. Then coming to third vaccine, that is hepatitis B vaccine. Everybody knows its complication and its mode of transmission. And the mode of transmission is common. That is, mode of transmission is through blood and the body fluids. And as the diabetic patients are used to have more pricks, that is needle pricks, because of repeated test and insulin administration, there is more chance to be infected by hepatitis B vaccine, hepatitis B infection. That is why CDC recommends every diabetic patient below the age of 60 should be immunized as per schedule by hepatitis B vaccine, and the booster dose of hepatitis B should be decided after the evaluation of titer. Booster dose to be should be decided after evaluation of titer, and every patient below age 60 should be given hepatitis B vaccination as per schedule. Then coming to the fourth vaccine, that is TDR. It is a single shot vaccine, combination of 3 vaccines that gives protection to 3 diseases, that is tetanus, diphtheria and pertussis. As guideline says, if a patient not having history of taking the vaccine previously, he or she should take it immediately as soon as possible. And the booster dose of tetanus should be given 10 years afterwards. Then coming to zoster, it is a painful blister disease. Zoster is a painful blister disease, and everybody knows this painful blister disease has later consequence of long-term neuralgia, and that increases with age. So CDC recommends the zoster vaccine for every people the age of 50 years old and later age groups also. Lastly, I will say nothing is 100% preventable for a disease or its complication, but we can reduce, or the vaccine can reduce the severity of the complication. So please consult your doctor today and remain up to date regarding your vaccination. If you are diabetic, it is a serious message to all diabetic patients. This much for today. In near future, I will be coming with another topic of discussion, and I will try to make it more interesting. And remember, prevention is better than cure. Thank you for today.